patients are called to see the specialist by appointment. Is this a good solution? I asked a doctor.
We have an appointment system in our hospitals, which means that a patient only has to wait quarter of an hour to 20 minutes, that's in theory anyway, before he sees the consultant. This seems all very well on paper, but it does mean that in many cases one fails to secure an appointment for a patient for anything up to 7 or 8 weeks. The old system, whereby a patient was sent to the hospital by his doctor and saw a consultant after waiting, say, anything up to 3 or 4 hours, which didn't matter a great deal when, after 3 or 4 hours, he secured an early diagnosis which relieved the anxiety he would have felt for all these weeks waiting and worrying about his health. The reasons for this state of affairs are several. Firstly, there's the increased demand of the public for hospital services. Then, in the old days, the consultants started early in the morning and worked until 3 or even 4 in the afternoon until they'd seen all the patients the general practitioners had sent them. Today, the consultants start at a fixed time. They have so many appointments allocated to them, and then they are finished. Of course, I do believe that none of this would have come about at all if it hadn't been for the clamour of the newspapers and the politicians. Most of us were perfectly satisfied with the old state of affairs. However, there's some hope for the future, because in Salford we have formed a committee which consists of representatives of the general practitioners, of the municipal health services who originated this idea, and of the hospital management committees. And we have done many things to improve matters for both the patient and for the general practitioner. For instance, there's the bed bureau.
Bed bureau here? Yes, doctor. And the patient's name?
Any doctor in Salford with a patient needing to go into hospital can telephone the bureau and most times find a bed. The bureau covers all the hospitals in the city, and on its walls are charts indicating the state of every bed in every hospital.
Yes, there is a bed on Mr. Brown's ward at Hope Hospital. Temperature, 103.
Within 15 minutes on average, the doctor will get a call back to confirm that the hospital has accepted his patient. The hospital X-ray service is also available to the general practitioner. If he wishes, a telephone call will bring him a report within a few hours.
Of urgent importance, the lumbar spine is clearly shown, and there does not appear to be any evidence of a fracture.
If a patient needs a blood count, or if the doctor comes across an infection he cannot identify, the hospital laboratory service is there to help him. These services are at the elbow of every doctor in the city through the cooperation of the 3 branches of the National Health Service: family doctors, hospitals, and the Public Health Service. It's working well in Salford, but is there room throughout the country for more cooperation between these 3 branches? Many doctors say that this is the greatest weakness of the National Health Service. I raised this question with the Medical Officer of Health.
Cooperation is the keynote of the National Health Service today. There can't be enough of it. Indeed, I think instead of 3 branches of the National Health Service, there should be 1 branch only responsible for all services for the health of the people. My job as a medical officer of health is to promote the health of the people by better health education, better nutrition, better housing. And secondly, to prevent preventable disease by removal or lessening the environmental evils of bad housing and bad food, and also to prevent disease by developing the immunizations and vaccinations and protections against disease. Not so very long ago, there was much bad food, bad drainage systems, dangerous diseases like diphtheria and rickets. There's been grand progress lately, but new problems loom ahead. The problem, for example, of cleaning the air. The problem of building up the physical health and the mental health of the people. Yes, there's no more important job than that of preventive medicine, and it'll got to have a great deal bigger place, not merely in our national and in our local budgets, but also in our minds and the way we look at things.
The local health services are in the main concerned with preventive medicine. They start before a child is born in the antenatal clinic, where medical examination and health teaching run side by side, helping to prepare the mother for when her baby comes. If she is healthy and if the birth is a normal one, she can be attended to at home. I suppose most of us drew our first breath in the capable hands of a midwife. If the birth is likely to be abnormal, it should take place in hospital. But otherwise, the general medical view is that this natural function is best carried out in the familiar surroundings of the home. After all, babies were born before hospitals existed. In their early years, many babies are brought to the child welfare clinic, where a regular watch is kept on their progress. But some people say that these clinics could easily lead the mothers to worry too much about their baby's health. They say a confident mother with plenty of milk for her baby is more important than a weighing machine. One job of the medical and nursing staff is to inspire this confidence. Through the school health service, the child's health is watched over by the local authority until it's time for him to start work as an insured person in his own right. The local authority's interest in the health of the family lasts for a lifetime. Health visitors coming to people in their own homes give advice and help on any problem of family health. In Salford, the health visitor service is a matter of local pride. I went with Nurse Brooks on her daily round.
Hello, Miss Haney. How are you?
Oh, fine, thanks.
How's the new house?
Oh, smashing.
Oh, I'm very glad. Mrs. Haney's been very unfortunate. Just like Mrs. Clark we're going to see now. Her husband died about 4 weeks before this last baby was born. She's got 8 other children, and she did lose 3 of her babies when they were infants. Altogether, they're a very nice family, but they have had a lot of accidents recently.
So?
In fact, this last baby was planned for a home delivery, but at the last minute, Mrs. Clark had to go to hospital for an emergency operation. The whole family had to be looked after by her eldest daughter, who's only 17. I'll just see if she's in.
Right.
There's one little boy of 2. He's had to go to the day nursery. And,
Hello, Miss Rose. I'm just as I want you.
Hello, Mrs. Clark. I've got Mr. Reed with me. May we come and see
pleased
you?
to meet you.
How do
Yes,
you do,
come
Mrs.
in.
Clark?
Thank you. Sit down, Mr. Reed. It's cold, isn't it?
It is, by Jove. Thanks very much.
Oh, it's a lovely baby.
And she look well.
She does look well, yes.
Yes.
And she's only 6 weeks old.
6 weeks old, 7 weeks old on Thursday.
7 weeks old, yes.
Yes.
She's fine.
Yes.
And how are the rest of the family?
They're all fine, but little John, I'm very worried about little John. He seems to be fretting.
Why, what's the trouble?
Well, we have to watch him. He hits the baby and does, and when he goes to bed at night, he won't stay in the bed. He comes down and he asks is his mama still at home. Wonder what it is.
Well, you know, so many bewildering things have happened to John in the last 2 months.
Yeah.
Losing his father, and then you went away to hospital. You know, he came down one morning and just found that you'd gone.
Yes.
And then you came home with a new baby. I think that he'll get over this, but the thing for you to do is try to reassure him all the time that you aren't going away again to leave him.
Yeah, I do, you know, I do tell him that his mama won't go away no more, you know.
If you hadn't settled down so well in the day nursery, I'd suggest that he came home again to you. Perhaps when you're feeling a little stronger, you have him home with you, and he'll see more of you.
All right, Miss Brooks.
Yes. Now, about the baby. What do you think about the immunisation?
Well, I want her immunised, but I was wondering when to bring her up.
In another health visitors district, I asked Mrs. Morris whether she liked the health visitors.
No, I don't, for one reason. They try to domineer married people who has a lot of children. They've no kids of their own, and they're sending bits of girls round who's not married. They know nothing, but they try to tell you what to give your children. And because I have 9 kiddies and I'm for my 10th, they try to tell me to go to birth controls and things like that, which I wouldn't do, not for any of them. And when they come near this door, I always insult them because I don't like them.
But most housewives agreed with Mrs. Hall, and from her I received a very different opinion.
Oh, I think they're really marvellous. You see, my mother died when I was quite young, and my sister isn't married, so we didn't know what to do for the best. And after I'd been home a couple of days from hospital, the health visitor came, and my husband and I had a nice chat to her. She told us all the things that we could do at the clinic. They weigh the babies for you, they give you all the advice on the feeding, and
did you take the baby round?
yes, I decided to have a try, and believe me, they've been marvellous in every way. They've helped us, and oh, it's really marvellous.